Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you.
Discover a new path to wellness at Arizona Metabolic Health. Dr. Brian Lenzkes offers advanced medicine and personalized care, treating the root causes of your health concerns, not just the symptoms. Whether you're seeking direct primary care, effective diabetes management, or medical weight loss, with a holistic approach, our team is here to guide you every step of the way. Visit ArizonaMetabolicHealth.com today to learn more about our innovative health solutions.
Oh my goodness, everyone, it's May. That means summer's coming, swimsuits and fancy clothes and all that kind of stuff. So gosh darn it, we gotta fix all the problems we did during the holidays and everything. So hopefully we're all staying on track. And I just want to thank Health Code for sponsoring this episode. They're helping us get into better shape and eat good nutrition and have some sweet stuff too along the way. So they have tons of recipes at their website, GetHealth, GetHLTH.com. And also we have a promo code MetHealth for metabolic health, METHEALTH. And so please help those guys, buy their products, use it. If you have parents who are getting older like mine, this is the best thing you could possibly do for them. Give them good nutrition and give ourselves good nutrition to prevent all these other things that are coming our way as we get older. So thank you, Health Code. And also try their berberine if you haven't tried it yet. It's a great berberine and it has anti-inflammatory in there. So, that's really good too for metabolic health. So thank you for listening and enjoy this episode. Hello and welcome back to the Life's Best Medicine podcast. I have a doc here, but it's a different type of doc than you may have been used to hearing. As a matter of fact, I think you might be my first veterinarian that I've had on to talk about it. Dr. Emily Roth, welcome.
Thank you.
So good to talk to you and catch up. So let's start from the very beginning. Now you're doing holistic trails, like healing, like a holistic type of veterinary work.
Medicine. Mm-hmm.
Yeah. So how did you get to be a veterinarian? Did you grow up as a kid thinking, oh, I love animals and that's what I want to do? Or how did you fall into this?
So that's a typical thing that people hear is like, oh, I love animals, I want to be a veterinarian. Like, sure, that's definitely something that is super common. But I cycled through wanting to be an astronaut. I cycled through wanting to be a pop singer. I actually grew up as a vocalist. And for a while, I thought that that's what I wanted to do. But I grew up riding horses and always had animals in the house, and eventually decided that I was going to go into equine science and receive a pre-veterinary degree. So that's kind of where I ended up going with that. Predominantly horses were my catalyst for that.
So cool. Then what happened?
So I became exposed to acupuncture in animals when I did an internship at the Center for Rehabilitation of Wildlife, which is on Sanibel Island in Florida. And interestingly enough, some of the doctors there were certified in Chinese medicine, and I got to see them use Chinese herbs and acupuncture on things like pelicans and tortoises and snakes, and I thought it was really wild. And I really liked the concepts of Chinese medicine. And then when I was in undergrad as well, about maybe 19, 20, I was riding horses a lot, had a horse, and got introduced to a equine veterinarian. And I begged and begged and begged her to let me ride with her, and she was like, "I'm not taking students. I'm not doing this." And I was super persistent, and she eventually let me ride with her, and I saw what acupuncture did on horses, and I was like, hands down, I am going to veterinary school so that I can be a veterinary acupuncturist. Like, if nothing else, because in some states you can't be an acupuncturist on animals unless you are a veterinarian. So I was like, this is it. That's what I want to do. And um and then throughout I went to Ohio State in Columbus, Ohio. I'm from Ohio originally. And I created my own kind of fourth year, senior year specialty, well, not specialty, but um, specialized, individualized fourth year where I took a spinal manipulation course. I'm certified in spinal manipulation for large and small animals. I also took my veterinary acupuncture certification during my fourth year. So I took two additional certifications
Wow.
in on top of finishing my clinical year. And then I worked with a bunch of different holistic veterinarians around the country.
It's so cool to hear this because I remember like, when us Western medicine people, they go, oh yeah, there's just a placebo effect with that. And then I saw them do it on dogs and horses, and you see them limping in and then running off. So what was your experience? What was that moment when you go, oh my gosh, there's power to this?
So I think, I mean, I've been practicing on horses and dogs for many years now, and as a student prior to that. But I think with the horses, I mean, I have had horses just drop their heads to the ground almost as if they were given a sedative. And the only thing that we did was sometimes even just dry needle, meaning no electricity, anything like that, just strict dry needles. And watching the the relaxation response from horses, decreasing pain response, seeing lameness decrease, seeing increased GI motility, or decreased GI motility, because you can use acupuncture for both diarrhea and constipation, which is really cool. So I think, again, they have zero clue. You cannot explain to a dog, cat, bird, whatever, that you stick this needle in this spot and they're going to feel better. And there's so many studies now. There's a lot of studies in humans, but there's a lot of studies in animals as well that have proven this, both horses, rats, dogs, you name it.
Yeah, it's pretty amazing to see, because again, I've had heard so many Western docs say that's just a placebo effect. It's like the horse is thinking that's going to get better by sticking needles in it, really? And then once they
No,
see it, they go, huh, let me think about this. What's the mechanism? Why are they getting better?
right. And I mean, that's a huge topic. There's, electricity, right? We're all made of electricity. There's that component, there's lymphatic component, there's release of endogenous opioids, histamine release, T cell release. I mean, we could talk about just that for an hour. So,
Yeah,
but
it's amazing. Yeah, it's amazing. But just saying, hey, look, you don't have to drug up your animal. There's things we can do outside of what we would consider like veterinary medicine or Western medicine. Because it seems
well,
like veterinary medicine has gone like Western medicine where there's a pill and a shot and everything else too, right?
absolutely. And so I'm an integrative veterinarian, and something that I want to clarify, just because we use the word holistic does not mean strictly all natural,
Hmm.
right? And I know that you've probably experienced this yourself. I want to be natural, I want to be holistic. Sure, holistic is the whole body. I'm not, you come in limping, I'm not going to just take care of the limp. I'm going to take care of the GI system. I'm going to take care of whatever else there may be, the dentistry, all of those things. And so I use a combination, an integrative, holistic approach where if you need antibiotics, you need antibiotics. If you need
Hmm.
steroids, you need steroids, right? So I think that's something that can be a little bit frustrating to me because I will have people contact me and say, "Oh, you're a holistic vet. That means you don't believe in XYZ." And number one, please don't tell me what I do and don't believe. But number two, really the the best medicine is, in my opinion, the combination of Eastern and Western modalities.
Yeah, and you can minimize the use. Sometimes you just got to use it. We have meds and certain things. We go, okay, this is the time you use it. If you have double pneumonia, you don't say, well, I'm not going to take antibiotics. I'm going to let it see what happens. So there's definitely a time and a place, but I think a lot of it we can avoid the medicines or taper down medicines by getting pain under control or getting the diarrhea under control, by other methods.
Well, and to segue into real quick, if we want to just talk about insulin just for a little bit,
Yeah, I would love
um,
to. That's what we usually talk about here, but
I
that's
know.
why we're doing this too. We had this
Yeah, I mean,
conversation about insulin resistance. Yeah.
yeah, we'll talk a little bit about that because I think there are a lot of other things that I I'd love to talk about. But for instance, now granted, this case was primarily a natural case, meaning no pharmaceutical medications. But I have a client that has a cat that was diagnosed diabetic, and in cats, typically it is the insulin resistance type 2 diabetes, right?
Mhm.
And very often it's reversible, which is super exciting. And she was just like, I absolutely don't want to do insulin, you know, so on and so forth. And I was a little bit worried because I really didn't like kind of how the cat was doing, where the numbers were. And with diet supplements alone, we were able to get this cat back into a normal glycemic state. So I think that is, again, it can be done. And I'm not saying it should always be done that way.
Mhm.
But, if you have a diabetic ketoacidosis, you absolutely cannot just say, oh, let's just try diet for 3 weeks or 6 weeks or whatever. But I think it's important to know that you can reverse a lot of this stuff just like in humans, right? With diet. And that's a huge thing. And I could go on and on about um the amount of carbohydrates, right? In a lot of the pet foods and the obesity epidemic that we're seeing in pets right now, pets and even livestock, right? Horses, you can consider them livestock or pets, however you would like. But it is the concentrate of carbohydrates is so high, and none of these animals eat that way in the wild. And so why are we seeing all these things, right? A lot of this is man-made.
Yeah, this is a huge topic. I lost my lab to diabetes. She like one day she was drinking all this water. I'm like, she's losing weight. She's drinking water all the time. Why does she got diabetes? We checked her. I'm like, oh shoot. We took her to the vet, and the vet said diet has zero to do with. And this whole time I'm treating diabetics and getting them off insulin, right, with time. And what
Right.
you said very astutely, which is very true, is that if you're in diabetic ketoacidosis, you have to take insulin. That means your body stopped making insulin. You're in big trouble. So you have to shut off that sugar release by glucagon. So shooting insulin will shut down that release. So you could eat zero carbohydrates if you're not making insulin, you're in major trouble. Dogs and cats the same. And so sometimes you have to do it. You have to pick your poison to shut down the damage, and then we can work on lifestyle, and that's a really important point.
I will say in dogs, they typically do tend to be type 1 diabetic, so insulin dependent.
Mhm.
But in in my mind, the question is why are their pancreas having so much destruction of those islet cells, right? And I I want to believe, I don't know that I have a study to back this, but I would be shocked if it didn't have something to do with chronic inflammation, right?
Absolutely. Yeah, humans the same, right? It's a gut issue. A lot of times this comes back to gut issues when people have really leaky gut, all these issues. these autoimmune disease. We know it for sure with Crohn's disease and some of the other
Hmm.
diseases that we see. Irritable bowel syndrome, even that I was just reading saying it's leaky gut. The gut's leaky because you have so much toxicity, whatever you're eating that's bad, and your immune system gets revved up, and you start attacking different parts of your body, like thyroid disease, things like that. Also, autoimmune
Right. Was
diseases.
autoimmune.
And they're
Hmm.
all, yeah, you're correct, all inflammatory in nature. So when I see a high inflammatory marker, it's one of the red flags for me, like, oh, something's wrong.
Right. And I don't know the current research on dogs and diabetes in terms of, you know, what if they're specifically looking at like long-term diet studies. I highly doubt it. But I would say that a lot of the dogs, and I better be careful here. Um, a lot of the dogs have been chronically overweight at one point, and pancreatitis, right, is a really big reason that dogs are predisposed to getting diabetes at some point. So, chronic inflammatory processes in the pancreas, what does it do, right? The pancreas is like this incredibly delicate organ that doesn't have a lot of wiggle room. Sometimes in a normal ultrasound, so if you're looking for the pancreas in a normal ultrasound just as a scan, somebody's doing an abdominal ultrasound on a dog, it's good to not find it. We don't really want to find it,
Mhm.
right? Because um that means that it's quiet. And so I would I would be hard pressed to believe if there wasn't a link to chronic inflammation, high carbohydrate, poor diets. Unfortunately, I dare I say the word kibble, right? And that again could be a topic that we could talk about for probably 4 hours. But it just makes me wonder. And again, a lot of these dogs are significantly overweight, and I think there's chronic inflammation, and then they just hit a point where their pancreas is like, I'm done, and then they do become insulin dependent, type 1.
Yeah, because they burn out their pancreas and all those beta cells are gone. Now what do you do? And I don't know if you see it in animals, but humans we see a precursor to diabetes and a lot of the metabolic disease is fatty liver disease. So we see elevation of liver tests, and on ultrasound you see fatty deposits in the liver as a precursor to getting diabetes.
I don't know that personally in in practice that I have experienced, but I would definitely say that the liver is absolutely affected, and we do see chronic hepatic changes
Mhm.
in uh, in diabetic patients. We see increased liver enzymes in diabetic patients. I don't know that I would say that somebody has done an ultrasound scan and said this is definitely fatty liver, but they will say like vascular or some types
Mhm.
of changes on imaging for sure.
Yeah, and
um and you wonder too, like, if in one of the big things too, and this is the other thing that a lot of people, they don't want to do the screenings for their animals. They don't want to do annual blood work or like ultrasounds, those types of things. And I understand it's expensive, right? Like I empathize with that significantly. It's expensive for me too. But especially once these dogs become seniors, I think it's really important to start that annual blood works, doing scanning abdominal ultrasound. You can find tumors, you can find all sorts of stuff. And if you catch it early, you may have a lot more years.
yeah, and and that's really important screening, making sure you stay up on things. Just like what I do is like we find stuff and go, oh, you're on the road to diabetes, your insulin's super high. You have all these markers that we go, oh, there's the check engine lights just came on. Let's fix it. And
Right.
so I'm curious, like, what's your take on nutrition for animals? Like, for instance, people put their values on dogs. They may have them be carnivore, they may have them be vegan, and you look and you're like,
Hmm.
what's natural for the dog? How often should a dog eat? Because people say, well, you have to eat your dog. Some people do, and I would love to hear your take on this, where they do on-demand feeding where they just have a bowl there and the dog eats all
Free
day.
feeding. It's called
Huh?
free feeding.
Free feeding, yeah,
Yeah.
versus like, hey, let's have a set meal time. Like, does a dog need to eat 6 times a day? All these kind of things. Like, how often should we be feeding our dogs, and what should we be feeding them?
So, disclaimer, I am not a veterinary nutritionist. I am not boarded in nutrition. I am not specialized in any of that.
Uh,
A lot of mine is just experience, anecdotal, and there are definitely a lot of studies coming out now that are linking diet and allergies and potentially inflammatory bowel disease. Um, so the answer to that question is it depends. And my teacher from the Chi University, he is a world-renowned veterinary acupuncturist, and he teaches, all of the courses at the Chi University. It used to be called the Chi Institute, but now they're actually a university, which is really cool. They offer a master's program in Chinese medicine, traditional Chinese medicine for veterinarians. Um, but he always says it depends, right? Because everyone's like, well, Dr. Shea, how much of this herb and how much of that, and what if this and what if, he always says it depends. So,
mhm.
um, and so it just makes me laugh. But um, so I think, like I had mentioned earlier, that the the diets that we're seeing in terms of the dry diets, all kibble, they're incredibly high in carbohydrates. And if you look at the dentition of a cat or a dog, they are not grinding teeth, right? They are
Mhm.
all sharp teeth, except for some of the very back ones in dog mouths, which some people may argue, okay, well, maybe they're quote unquote omnivorous, which they are opportunistic, I think.
Mhm.
I think any animal is going to be opportunistic in the event of starvation, right? um I am a big proponent of both home cooked, balanced meals, which there has been a massive influx of veterinary support in terms of companies that offer very easy diets with balancing supplements, balancing to make it appropriate in terms of the macro and micronutrients, right? It's not
Mhm.
as simple as, oh, well, I feed my dog ground turkey and white rice, and then I sprinkle this like random vitamin that I got off of Chewy, which is like, you know, we could go on about that for a long time too. Um, but there are some really great companies that are working with veterinary nutritionists that have formulated diets. Just Food for Dogs is one of them. Another one, if for the holistic kind of Chinese medicine minded people, is called Chi Dog. Those are really good for the home cooked. And then I'm gonna say it, raw diets, commercial raw. I am definitely a supporter of that. Now, it is not for every patient. There are certain
Mhm.
health conditions, certain GI issues. Some dogs hate it. Some dogs, regardless, you could try 10 different brands, doesn't do well with it. I think, older dogs, depending on how they're doing, what their health looks like, so on and so forth, I think can still handle raw. Um, there are there are a multitude of raw dog food companies as well, commercial raw dog food where they, test and hold and they look at the bacterial contents, and it's not just this random person in their backyard, well, I have some pigs and here's some pork and I ground it together and have a great day. So, but I think raw is phenomenal, especially for sporting dogs, and honestly, you know, a lot of dogs can do very, very well on it. It is expensive, um, unfortunately, and the larger the dog, the more expensive it's going to be. Except for my dog, which she's 30 pounds and she eats the equivalent of a 60-pound dog. So, yeah, she's special, but, and there's nothing wrong with her. She just has a high metabolic rate. So, um, but and then, on the feeding, aspect of it, in terms of how often to feed, think that's also a very it depends answer.
Hmm.
I was speaking to a nutrition colleague of mine, a boarded veterinary nutritionist, and there are some studies that support feeding once a day might be better for cognition. I don't
Hmm.
know if there's anything in humans that may support, I mean, I know we go into the whole like intermittent fasting thing and whatever.
Hmm.
Um, so, but I think in general, at least 2 meals a day. But some dogs, depending on chronic GI issues or like GI motility issues, um, they may need more smaller frequent meals. But I would absolutely not, and I can't think other than puppies, right? Um, think of a reason to free feed animals because I would say, and I mean, this is just a rough number thinking about my experience, but I would say that, you know, as a veterinarian looking at my obese patients, I would say like probably 80 to 90% of them, they just say, "Oh, we just fill the bowl."
Hmm.
And he doesn't eat that much or she doesn't eat that much. Well, there's no portion control, so you don't really know if you're just kind of filling it. I mean, the monotony of your day, you're not going to remember, and if you're not measuring it and knowing exactly how many kcals are in each serving and how much per day and what the appropriately calculated dietary needs are, it's almost always over.
Yeah, and especially if they're getting kibble, right? You go,
Mhm.
gosh, that's not going to be nutritionally satisfying. They're going to eat more and more of that trying to get their nutrition, and
Yep.
that's not going to be helpful for the dog or cat.
Well, and a lot of people have a really hard time, especially with cats, because cats are a little bit, I think in terms of like pet wise, people think they're a little bit more on the convenience side because you can just leave a bowl out, right? You can leave them for a couple of days; they're going to be fine. They don't need a walk. They go in a litter box, which can stay in the house, and so on and so forth. And then it's so easy to leave the dry food out. Right. Um, but I would say, like I said, probably 80 to 90% of these animals that I'm seeing are obese, the free fed animals. I've seen it work on rare occasion, for some like like ranch dogs and stuff like that, that just there's so metabolic that,
Hmm.
highly metabolic that it's okay, but rarely do I see the free feeding work in anybody's favor.
Yeah, probably animals that live in the house are probably not getting as much exercise as dogs that are out running around doing stuff out in nature, and and it's important for us too to take our dogs out for a walk, get out and get the exercise in too.
Mhm. Well,
Um,
and that brings me to another point too that is I think really important. Um, and I think a lot of canine trainers will probably also say this as well. I'm not speaking for anyone in particular, but just and also my own experience with my own dog. Um, taking your dog for a 1 mile walk a day is not enough. They have to have other things to do, whether it be playing, whether it be scent work, whether it be training tricks or obedience or something like that. Um, puzzle toys, all sorts of things that you can do, but it is our responsibility if you have an animal, especially a dog with behavioral issues and or anxiety. If you tell me you take that dog for one mile walk a day, it is not enough. It's not enough. And it's just like us, right? Like I think if we sit, for 18 hours a day, or we sleep for 16 hours a day or whatever, and we get up and we just go for a really quick walk, I think our brains aren't going to be very well. I don't think I know that
yeah, for
our
sure. Yeah.
brains are not okay. Our bodies aren't okay, and our brains definitely aren't. Especially those with mental health concerns and or anxiety in particular on the human side. But I'm not a human anything, but you know just
You
speaking from
see
my
it. Yeah,
personal
yeah. No, we see
experience.
it. People who
So
are more active and hiking and carrying stuff and gardening and doing activities. You're going to do better
right.
than, if you want to make someone constipated and miserable, put them in the hospital for a week and they lay in bed all day. They're getting terrible food. Their stomach's messed up. They feel, it's like, hey, get up and move, exercise, move, do
Yeah.
something. Obviously, there's times when you can't, when you're getting a surgery or something like that. But
Right.
yeah, we just see that as a huge issue. So let's jump back to the horses. What about insulin resistance in horses? What do you see in that?
Well, I think that's a big topic, but yeah, I mean, insulin resistance is super common, and I, one of the biggest ways to combat it is through changing diet, decreasing the carbohydrates, and so a lot of these horses are on, you know, foods that are too high in carbohydrates, or particular types of hay and or concentrates. They're called concentrated feeds, like a senior
Mhm.
feed or a performance feed, but a lot of them have really high carbohydrate and they also have a lot of molasses in them. So it, and it's kind of like an old school thing. It's you know there's been a huge advancement in equine nutrition from years ago, but I mean, I remember even when I was in in undergrad in the equine science program, we were making the food for our horses, and we were doing corn, oats, and then molasses to stick it together. And something didn't feel right about that to me, but I was like, I guess this is like what we're supposed to do. And lo and behold, my horse that I had in undergrad, I brought him back to Ohio. I went to school in West Virginia, and then I brought him back to Ohio. Um, he ended up being insulin resistant. And I changed the food, and it was great. So, and he was fine. So a lot of these horses, and you can use Chinese herbs, you can use some other types of things as well. Um, there's other drugs. A lot of the times they have other conditions like PPID, um, and thyroid issues. So I mean, but I do think, again, horses in the wild, they're not going and grazing cornfields, right? Like, and and they're not standing in a stall, right? They're not standing in a stall all day. I mean, some horses are, depending on where you are in the country, and or just the boarding facility in general. These teeny tiny little stalls with, like, a 10-foot run out of the back of it. I mean, they're not interacting with other horses like they normally would. They're not in that herd mentality. They're having all sorts of anxiety ridden behaviors because things are just not natural. And then it goes back to leaky gut syndrome too, right? Like chronic stress and chronic inflammation. You got to wonder if that's contributing, and I absolutely think it probably does.
Yeah, just the stress. Just we know from human studies that exercise improves the diversity of the gut microbiome. Getting out in the sun, watching your stress levels, getting enough sleep. All these kind of things are huge factors that we look at and go, okay, let's work on some of these factors. So if a horse is cooped up and they can't get out and run and like get their, all their energy out, that definitely I could see that contributing.
Yeah.
And it may be
Yeah. And
even like like race horses or horses are very active compared to a horse that's not doing a lot. They would probably have different nutritional needs.
right, for sure. Yeah. I mean, protein, fat content, all that kind of stuff depends on exercise level and whatnot. And again, a lot I think there's like this I think there's a lot of anthropomorphizing, and this not only applies to horses, I think, but also to dogs and cats. It's like, well, they're hungry, and
Hmm.
they should have a snack, and they should have you know what I mean? And so I think a lot of the times, and it's not ill intent, but a horse that isn't being ridden, isn't barely having turnout, so on and so forth. Like, why are we even feeding them concentrated feed? Like, why are we feeding them grains? um and I'm not speaking for everyone, because there's reasons for certain things, right? Sometimes you have to give a little tiny bit if they're on certain medications or supplements and so on and so forth. But
Mhm.
I mean, they really don't need these huge meals. They're meant to be eating hay and foraging grass and pulling stuff off trees and all the sorts for hours on end, and walking miles and miles and miles a day. They're not, standing in stalls and getting fed this bucket of, sweet molassed concentrate. So, and horse owners, don't come at me, but and I think in general a lot of the horse community has changed how they're feeding. But um, there's definitely some people that I think need to really think about. And I'm not saying don't own horse. I mean, I've been an equestrian my most of my life. I mean, since I was 8 years old. Um, and I think that they are on this earth to teach us something. And this is not like anti horse ownership, anti riding, anti anything. It's just simply think about how we are housing our horses, how they are, living, and what can we do to make it as to mimic the as natural of the process that it would be if they were roaming, right? Um, and it can be very, very difficult. It can be very difficult.
Yeah, it's wild. I was well, I go back. We were gonna go to the zoo in Guatemala, and we happened to a lady who runs the zoo there, and she says you could go see the grizzly bears, but you can't see them on like Tuesdays. Like, why not Tuesdays? What they do is they bring in wild fish and they put them in there and they let them hunt. And they said
That's
they'll lose
awesome.
those and they go and hunt and they're active. But if people are there watching, they won't do it because it's not natural. But if they're naturally there and they close that part of the park, they'll go out and hunt and they learn how, like, just giving them a dead fish is different than them actually going out and hunting, the brown bears and the grizzly bears. So it's kind of cool that, like, what you
Yeah.
can do and let them have some of that. And they had a huge area to roam and everything. They weren't just cooped up in a little cage. Like, I've always hated that about the zoo, is that they're like, a lion in a little cage. That's not very good.
Well, and I mean, zoos are I actually I was an intern at a zoo for a little while. And um I think that it has become very apparent that how things used to be done is not the best way. And I think most zoos, at least the zoo that I was a part of, and I think a lot of the zoos now are really working on enrichment, right? So
Mhm.
enrichment for these animals, because it is it's just not it's not normal. Right? And again, I'm a huge supporter of the educational perspective and the breeding programs and endangered species protection
Mhm.
and education and all of that. I mean, zoos, I think, are phenomenal. But it is a full-time job to keep those animals from, you know developing these really, really um, detrimental kind of psychological issues, because they are just not in a normal environment. And you'll see the photos and the videos of animals just pacing and pacing
Mhm.
and
Mhm.
pacing and pacing, right? And that is not normal, right? I mean, they wouldn't do that in the wild, and it's because they aren't having the appropriate stimulation. And I just think it's really important for people to understand that it's not only zoos, but it's your animals that live in your home as well, right? It's the animals, it's the dogs that you have, the cats that you have, the horses that you have, all of these things. Just making sure that you are giving them the stimulation, mental, physical, emotional, that they need. um and it's heartbreaking to me sometimes, especially seeing these animals come in to clinics. Now I get to see I'm a little bit spoiled because I am a mobile veterinarian, so I'm in homes a lot, and they're typically a lot more relaxed. But it is very, very, very important to do the proper training, do the proper exercise, do the enrichment, because the amount of stories, personal experiences that I've had with aggressive and or severely anxious animals that you can barely touch is just sad. Um, and it puts a lot of strain on the owner. It puts a lot of strain
Mhm.
on the animal. It puts a lot of strain on the support staff in the veterinary field and in the vet and on the veterinarians. And not to mention the safety, right? Like the safety of myself, the safety
Mhm.
of my staff, the safety of the animal, the safety of the owner. So I mean, it's not trivial.
Yeah, it's huge. And when dogs aren't socialized or animals aren't socialized, it's a huge issue. Like I see that a lot where people, there's this one dog on my street. It looks like a sheep dog. It looks very tame, but it goes crazy, attacks people all the time. You go, oh my gosh. Yeah, it's
Right.
hard when the owner can't handle the dog and the dog needs energy to get out and socialize and all those kind of things. It's sad to see.
Yeah. And I and the frustration should not be directed at the animal, right? Because the animal doesn't know any better. And so we as owners and advocates need to take the responsibility to work with veterinarians, work with dog trainers, sometimes even veterinary behaviorists, which is a specialty in and of itself. So, I have a colleague that I went to veterinary school with that, went through the specialty. And so not only did he do undergrad, but he then went to veterinary school. He then did another, I believe, 3 to 4 years after that to then specialize in a very specific realm of veterinary medicine. And so, I mean, there are people that can help with that, and some of them are even offering telemedicine consults, which is great because you don't necessarily have to, physically be there because there's not many of them. So, I think it's just very, very important to understand that you are taking the responsibility for those animals and do what you can. And if you are unclear, please seek out help. You can talk to me, you can talk to, local dog trainers that I know, all of those kinds of things,
Hmm.
because a lot of it can be mitigated, but it's a lot of work. I mean, it's a lot of work, but it's our responsibility to take care of these animals, not just give them the food and the water, right? Or
Yeah,
the
and
half
you have
mile
to.
walk,
A lot of
right?
times you have to retrain the owners. They're stressed and tense, and the dog senses that, and then the dog becomes aggressive to protect their owner. So once people understand how the dynamics of animals, I mean, it's so important to read body language. You could tell when a dog is not going to be friendly, or they're threatened or stressed or whatever, or insecure, and
Absolutely.
they attack because they're insecure too.
Right. Yeah. Yeah, it's just, I could go on and on about that. And I think it's been a little bit emotional recently because, of course, and I'm sure you as a healthcare professional are on, some support groups, maybe through social media, Facebook, whatnot. But I'm just seeing an influx of people, being very, very hurt, maimed, reconstruction surgery from unsocialized animals. Um, and there is a way to mitigate a lot of that. Again, sometimes there's not. You can sometimes do
Hmm.
everything. You can see a behaviorist, you can work with six different dog trainers, you can, use all the natural and Western pharmaceuticals, anti-anxiety, all this. And sometimes it's still, um, there's just there's no fixing it, and that's okay. But I think the vast majority of these cases just require some work, and it needs to be on the onus of the person responsible for that animal.
Yeah, it's a lot of responsibility. Like homeowners insurance, all those kind of things could be,
Right.
it's a big deal. You got to make sure. And then, also, if you don't like to walk the dog or play with the dog and do stuff, it's really looking, how do I make that happen? Whether it's getting a dog walker, someone, I don't care who it is, the kid, someone like got to exercise that dog or cat,
Right.
I mean, it's so important.
Absolutely. Yeah. I mean, there's plenty of people that love to do it too, and or, young kids are pretty are are pretty stoked about that kind of thing. And I've seen I compete my dog in agility. Um and I'm watching some javelina come through here.
No,
Um um but um there are kids that want to get out and do it. And if you as an owner might have a sporting dog or a working dog or something like that, like recruit somebody,
hmm
and they have a great time. I've seen some phenomenal junior handlers that are just really really good. And they can do agility, they can do herding work if they want, they can do um all sorts of stuff, right? Scent work, bite work, right? For the Malinois and German Shepherd type breeds. Um, kids can do a lot, and if you find one that's good, recruit them to help you with your animals.
Yeah, just playing catch, doing whatever, just getting out
Yeah.
there and doing things. So what are your favorite parts of your career calling? Like where do you get the most rewards? What do you really enjoy doing?
I really so I think this will probably segue us into talking a little bit about end of life.
Mhm.
And uh, this is something that I'm very passionate about. I think that it's very important to give a beautiful way out of this realm, whatever you believe, right? I
Mhm.
mean, we don't have to bring religion into this whatsoever. Um, but I offer in-home euthanasia services, and so I will come to someone's home and help their pet pass peacefully. Um, and there's been a lot of advancements in that, I think, in the past probably maybe 10 years or so. Don't quote me on that, but um, lots of very, very good pain and anti-anxiety medications, and actually using anesthetics prior to giving the injection that stops the heart. So we're not just simply sticking a vein and stopping the heart. We are giving it an immense amount of pain control and then actually putting the dogs and cats under anesthesia from injectable anesthesia, right? There's injectable and then there's the inhalant. I'm not carrying around an anesthesia machine with me. But I think, seeing the ability to allow patients to pass peacefully and working owners through that process has been something that is I would say rewarding to me. And people ask me all the time. They're like, "I can't believe, I are well, I hear a lot of things, but one thing that I hear people say is, I wanted to be a vet, but I could never euthanize an animal."
Mhm.
I hear I I hear that eh, a lot. And I would say that euthanizing animals is probably one of the gifts that I appreciate more than anything as being a veterinarian, because it is ending suffering and it
Mhm.
is providing a good death. And that is the literal translation of the word euthanasia is good death. So I think it's there's a lot of other facets of veterinary medicine that are very very difficult. And yes, it is difficult and it does take an emotional toll on me. And there are days where I'm like, this is very very hard. But
Mhm.
I think honoring the ending of suffering is one of the best gifts that we can give, and it's one of the best gifts as a veterinarian that I can give.
Yeah, that's such a huge thing because just having your animal home, not going into a sterile environment. I've seen it. I was with a friend when they had to put their dog down, and she was bleeding out, and they had no choice. And the way they were treated, well, I was like, oh my gosh, like they're like, okay, we you got 10 minutes, let's get this done, type thing, because they got other patients to see, that kind of thing, and the
Right.
stress on the family. But to have your animal your own home, my dog passed away on her own, so I was like, oh, you saved me that. Having to do that. But that day
Oh,
she went swimming and ran and played and did all this stuff. But she was getting older and I saw it coming. It's like, oh, that's going to be a brutal day. And then she saved me from that. But having to make that decision and having someone who's an expert to say, yeah, it's time, or maybe we could try this first and see what happens. But letting an animal suffer, I see it where people just the dog's blind and deaf and falling down and having accidents all the time and miserable, whining, and you go, oh my goodness, it gets inhumane at some point.
yeah, and I think the other portion of my job that I really like is working with chronic conditions and chronic pain.
Mhm.
Um, because a lot of people, and this is not to speak ill of anybody, more Western minded, right? But I've done an incredible amount of education and additional certification in modalities that are non-pharmaceutical, but also combining pharmaceuticals with non-pharmaceutical modalities and seeing my patients. I have multiple patients that are 14, 15 years old that are just killing it, and a lot of them are on Western medications, but I'm seeing them weekly or every 2 weeks or so and providing non pharmaceutical pain management options. And I think that's super rewarding seeing these geriatric animals do so well and the owners just be so happy that they still have their animals with them, and before it was like, well, we tried gabapentin and we tried a non-steroidal, and I'm like, okay, so let me open a box and then we'll start picking through the box and adding a couple of things at a time. And it's not just pain, right? It could be chronic GI problems and
Mhm.
neurologic things and all sorts of stuff, cancer. uh, but being able to offer something that's not just um a bottle of pills is something that I really, really enjoy. And then watching my patients go from not doing very well to doing extremely well and maintaining a, a level of quality of life that is acceptable, to me, to the owner, to the animal.
Yeah, it's huge. It's a huge thing of quality of life because that's what I talk about a lot is, we have a lifespan and we have a health
Right.
span.
Yep.
So you want your health span and your lifespan to match up. That's a blessing right there because you don't want to have a huge lifespan and a terrible health span and you're
Health span.
miserable laying there sitting, where you could go do things and, have fun and enjoy your family and all those things.
Yeah.
But you don't want to be sitting in a wheelchair, drooling and not recognizing anyone for the last 20 years of your life.
Right. And I mean, I could really go on about this for a very long time, but I think or I hope that someday, hopefully in my lifetime, that becomes a precedent in human medicine, that we are not allowing people to wither away in beds. I don't agree with it. I think it is I just think I think it's inhumane. And I think that's the difference between what I do and being able to give the gift of passing, right? Um versus some of the things, and family members and other people, that I know, friends of mine, listening to some of these stories, it's just, it can be really heartbreaking. And I'm hoping someday, as a collective humanity, that we can make that change. Because I just don't understand. Well, I do understand it, but not to bring that, morbid subject, but I just think it's really something that could be approved upon in the human healthcare system.
Yeah, it's one of those things where we're all going to get there at some point. We got to make that journey the best, and hopefully we just drop dead one day and you're done and not be languishing away. And I agree, it's such a hard topic. It's very emotional. There's a lot to it for sure, especially in
Right.
humans versus animals, right?
Right.
But yeah, it's a complex, but I think we can do a lot better. I think we have hospice. We have a lot of modalities where we can help people to alleviate suffering with acupuncture and just being there, the emotional stress, all these kind of things of
Right.
not being alone. All there's so much we can do, and I think I see a lot of people, they go, okay, I'm done, and they just kind of will it to be done, and they
Right.
yeah, like when they just hit their point, go, okay, I'm good, I'm at peace, let's just do this thing. And I've seen amazing things happen at the end of life, and you're right, it's a morbid, difficult subject, but we all get there at some point.
Yeah.
So
Well,
oh, go ahead.
yeah. Go go
Oh,
ahead.
I was gonna ask you, so what's life's best medicine for you? Where do you go when things are hard, these difficult emotional things? It is not easy. Your job is tough, going in and consoling the family and being there at the hardest times. And so where do you find your peace? Where do what's life's best medicine for Dr. Emily?
Life's best medicine. So, lots of things. I am an avid outdoors woman. So, pretty much if I am not doing well, I want to be outside all the time. I'm a trail runner. I'm a rock climber, backpacker, and then I do a lot of weight training, and I do a little bit of martial arts, which is really fun to do and helps stress relief. And then trail running is big too. I don't know. Did I already say that? Did I say trail running?
Yeah, just getting out. I
Yeah,
think in Prescott,
hiking, trail
that's
running.
what we
Yeah,
do, right? You just go hiking and you got lakes, you got all kinds of stuff, take your mind off stuff and hear birds. And yeah, just to be out in nature away from people sometimes is just yeah, for me too. I love just getting out, going for a mountain bike ride or hike or whatever, just to be away and like
yeah.
reflect on things, kind of go, what really matters in life? What's the important stuff?
And I do so much with my dog too, and so that's something that I think is really important, is that if you do have an animal, to make sure that you're spending a lot of the time with them and sharing those experiences, as long as it's not creating an issue with stress with the animal or stress with other people or other animals, right? And yeah, I mean, I'm typically hiking or walking daily, running 3, 4 times a week, rock climbing as much as I can. Um, Backpacking is not, I don't get to do as much because, you have to be away for that. But, even just on the weekend, like an overnight or, going camping and then rock climbing with friends, down in a canyon. And I was out at Groom Creek yesterday, bouldering with a couple rock climbing friends. So, I mean, I think it's really important to find community. And then I think one of the biggest things as well that I have seen, and I've been in the veterinary field for a long time, probably I think I was started when I was about 12 or 13 years old, is, you know, and I'm not saying don't be friends with your coworkers, but I think finding a community outside of, your specific, particularly medical field, I think can be really helpful, because sometimes what ends up happening is there's a little bit of toxic exchange and like a lot of
Talking
bitching.
shop, or you want to get away from it? Yeah, yeah, totally, right. Yeah.
So, and it's just like we were already stressed. We really need to like continue to relive this every single time we're hanging out with these people, right? And I'm not saying I've certainly have colleagues that are friends and that kind of thing that I spend time with, but I think it is important to make sure that you have a community, and that was super important to me when I was in veterinary school. I had a huge friend base of I started rock climbing I think 2014, but before. maybe a little bit before that. I don't remember what year, but I mean, that was my friend base. And so I wasn't, if I wasn't at school and I wasn't in study group with my colleagues, I wasn't hanging out necessarily with my colleagues because inevitably when I did, it was just like, oh man, this test, oh man, and it was just like,
Yeah.
it doesn't really lend to a really good mental place to be. So,
Yeah, you got to refresh your spirit and get out and do other stuff and not talk about the test or what's coming up next week and all those kind of things. Just get away from it. And I
yeah.
was just listening to something yesterday. I think they were saying that something to the nature of like 85% of the time you spend is with coworkers, more so than your family and friends. And you go, wow, because you think about how many
Wow.
hours well, you may be different because you're out now,
Yeah.
going to people, but a lot of people that are at a desk job, they're there with those people. At my old practice, I was with those guys like about way
Yeah.
more than my wife and my kids for sure.
I know. And that's sad,
Yeah,
right?
it's kind of sad. Yeah, so it is good to have friends that you can get away and go, okay, I'm not talking about medicine today. Let's go
Yeah.
talk about something else and enjoy life a little bit. So, how do people track you down, by the way, if they need your services and they're in the Prescott area, Arizona? So, how do people track you
Yeah.
down if they want to have you come to
So
the house?
the best way, I answering the phone can be pretty tough, especially when I'm driving and service sometimes, as we know, everyone's like, so many dead spots here. But I do have an inquiry form on my website. They can also text the phone number that's on my website. A lot of times the text will go through a little bit easier, or they can send me an email. Certainly call, leave a voicemail. I just sometimes I'm not able to actually answer the phone. Um, Texting is pretty easy. I can do that kind of in between things, and or filling out the inquiry form on the website and or sending me an email with as much relevant information as possible, because a lot of the times it'll just be like, my dog needs help,
Yeah.
and I'm like, okay. So trying to give me a little bit of background if you have medical records, letting me know who your primary care veterinarian is. I'm not what is considered a primary care veterinarian. I don't have a full service. I don't have like um a vehicle like that's a surgery suite, which they do have, where they actually do surgery on like a big van or a big
Hmm.
truck or something like that. And I don't offer, full service, imaging and all, full service diagnostics. So I always make sure that people have an establishment with a local clinic, so that if they were to need something, that they have that option. And I also work with all of the local clinics. They know who I am. Um, and so it's as simple as sometimes a phone call and email, and we can coordinate things like, hey, I think this patient might need x-rays or X, Y, and Z. And so, working together. And I would say that's another really fun thing that I've really enjoyed is having my part, but also being able to work with so many other people, and then them being really accepting and understanding and being willing to help, and then seeing some good results. So,
Yeah, yeah, that's awesome. So, do you have your website that we could put out? We'll put it in the show notes for sure, but do you have a phone number or website that we should give out to people right now?
yeah, it's healingtrailsholisticvet.com.
Cool, cool. Well, they'll track you down. So thanks so much for sharing. I learned a lot,
Yeah,
like learning about animals and how, we're not that far off as far as like these chronic diseases, chronic inflammation, all these diseases that are these, that are killing a lot of animals and people. And so we hopefully we can learn,
right.
get our nutrition and stress and sleep and go out like you're talking about, have community, go enjoy life, go whatever you float your boat, go rock climbing or kayaking or whatever. So everyone listening, this is great information. And so if you're not playing with your dog enough, you're not getting enough exercise, get out there and do it.
Yeah.
Today's a good day to do it, and be kind to yourself, be kind to others. And Doc, thanks so much for joining me.
Thank you, Doc. I appreciate it.
All right, have a great week.
You too. Safe travels.
Thank you. Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.